Namaskar. Hello and welcome to this episode of The Healing Hour with Dr. Surbhi. तो आज विश्व हेपेटाइटिस डे है एंड हेपेटाइटिस इज नोन टू बी अ ग्रुप ऑफ इन्फेक्शियस डिजीजेस ए बी सी डी एंड ई ये पांच प्रकार के हेपेटाइटिस वी ऑल नो एंड एक बहुत ही क्रॉनिक एक डिजीज है और वर्ल्ड हेल्थ ऑर्गेनाइजेशन इसको मनाता है प्रतिवर्ष 28 जुलाई को एंड 28th ऑफ जुलाई इज ऑल्सो द बर्थडे ऑफ बारुक सैमुअल ब्लूमबर्ग जिनकी यादगार में ये वर्ल्ड हेपेटाइटिस डे मनाया जाता है. So Barry Bloomberg, as he is popularly known as, he was the Nobel Prize winner in physiology or medicine in 1976. He was an American physician and geneticist, and he received the Nobel Prize for his work on the hepatitis B virus. So this is a brief background. So Dr. Survi, आपका स्वागत है in this healing hour. तो ये हेपेटाइटिस है क्या? हम लोग जनरली हेपेटाइटिस बी हेपेटाइटिस सी के बारे में तो ज़्यादा सुनते हैं, पर और ये शरीर के किस ऑर्गन को ये अफेक्ट करता है सबसे ज़्यादा? जैसे कि आप पृष्ठ भाग पर देख पाते हो, ये कुछ हमारा गुर्दा लिवर ये है. सो ओवर टू डॉक्टर सुरभि फॉर हर ओपनिंग रिमार्क्स ऑन हेपेटाइटिस फॉर दैट मैटर.
Very warm greetings on the World Hepatitis Day to one and all. And hepatitis is comes from the word hepa plus titus, itis. So hepa is liver and itis is inflammation. So liver is a very important organ. ये बहुत ही महत्वपूर्ण एक अभिन्न अंग है शरीर का, जिसके विभिन्न important functions रहते हैं in terms of metabolism in terms of like glucose, carbohydrate metabolism. It converts and stores glucose into glycogen for future storage by the body. It produces bile, which helps in fat digestion. Detoxification is a very important function of the liver. And various toxins and harmful substances are removed from the blood with the help of the liver. So liver helps in fat digestion. Liver helps also in protein digestion. Ammonia removal from the blood. And lot of
तो डॉक्टर सुरभि, जब हम खाना खाते हैं इट ऑल गोज टू आवर स्टमक, और उसके बाद वो जो भोजन का पचा हुआ द्रव्य है इट गोज टू द ब्लड स्ट्रीम. We generally have a fair idea about the kidneys that it filters out the impurities and we pass it through urine. So from the same blood stream, does the liver function? For just our viewers as a layman people.
Yes, because kidneys essentially forming urine. Kidneys digesting the water substances, whatever we are drinking, the fluids which we are drinking. Kidney is purifying the blood, and from the blood, the waste substances are going out in the form of urine. Liver is important because liver is a very essential organ because it has a host of diverse functions. One is, for example, as I said, carbohydrate metabolism.
So my question was, where does the liver receives its input from? From the bloodstream?
Yes, from the bloodstream.
Okay. So before it goes to kidney, it goes through liver, or how it functions? Is there a precedence order?
So, the bloodstream which is going, there's definitely it is going through the digestive system and then to the kidneys. So, liver is a part of the digestive system. So, in the end, it goes to the kidneys because that's when the
At the end, so from the stomach, it somewhere. See, it's a kind of an engineering kind of a tool. People understand their automobiles. People understand that. So from that perspective, कि how the body actually functions. So कहीं ना कहीं उस digestion के system में जो फूड डाइजेस्टेड हुआ है उसका जो द्रव्य है वो लिवर के थ्रू पास करता है, जहाँ पे फैट का डाइजेशन आपने कहा कि प्राइमरीली लिवर में होता है. सो नेक्स्ट डॉक्टर साहब, लिवर जो वाइटल ऑर्गन आपने बहुत सारे फंक्शंस बताए, ये रोग क्या है? ये हेपेटाइटिस का जो रोग है और जो पांच प्रकार के हेपेटाइटिस हैं, तो मोटा मोटा ये हेपेटाइटिस है क्या फॉर आवर व्यूअर्स?
So hepatitis, can be classified into two main diversifications, two main categories. One is viral hepatitis. Second is non-viral hepatitis.
Okay.
Viral hepatitis, we have the 5 forms: viral A, B, C, D, and E. These are all forms of viral hepatitis. Then non-viral hepatitis can be due to alcohol, which is drinking. It can be due to toxins, it can be due to over medication. Certain medicines like paracetamol and certain antibiotics can cause NSAIDs, painkillers can cause hepatitis. Even this is medicine or toxin induced hepatitis. Then we have autoimmune hepatitis, when the immune system of the body goes awry, and the body assumes the liver cells to be the enemy cells, and it starts damaging the own body. So that is autoimmune hepatitis. Similarly, we have the uh, drug induced, as I said, and alcoholic. And then, of course, there are some other miscellaneous kinds of hepatitis due to ischemia or, lack of blood supply.
तो अगर ये हेपेटाइटिस का रोग किसी भी कारण से अगर होता है, लेट्स कम टू दैट, तो शरीर में दिक्कतें क्या आनी शुरू हो जाती हैं? एक आम आदमी कैसे महसूस करे कि वो, चाहे वो वायरल है या नॉन वायरल है, पर वो हेपेटाइटिस के सिम्टम्स कैसे दिखने लगते हैं, शरीर में उसकी दिक्कतें क्या हैं?
So generally, hepatitis is, of course, as I said, inflammation of the liver. So first of all,
Inflammation of the liver, okay,
it is the
okay.
inflammation of the liver.
Mm-hmm.
So what happens is that there is a generalized weakness in the body.
Okay.
Fatigue sets in, weakness sets in, and there may be symptoms like nausea, vomiting, dizziness, fever may set in. In fact, in certain forms of hepatitis A and E, we have pruritus also, itching also in the body can come, because when the bilirubin level rises, it comes on the skin also, so causes that kind of
तो
symptomatology.
जिसको हम पीलिया या जॉन्डिस कहते हैं, वो भी एक प्रकार का हेपेटाइटिस ही है, आप ये कहेंगे?
Symptomatology syndrome, outer manifestation of viral hepatitis A, B, E, or that way. Jaundice is what is hepatitis. The manifestation of hepatitis is what we call jaundice या पीलिया जिसे कहते हैं. तो जॉन्डिस में यही होता है कि अब abdominal pain होता है, थोड़ा nausea होता है, थोड़ा सा आपको you will have weakness, don't feel like working, don't feel like doing the daily functions. But diagnosis of hepatitis is usually on through pathology. Because the liver function test will tell you about the serum bilirubin levels. They are raised, and then the viral markers. We have antibodies and antigen tests for these A, B, C, D, and E to know which type.
पर आपके पास जैसे कोई पेशेंट आता है, ये तो पैथोलॉजी तो सब कुछ निकाल देगा, पर आप किन कंडीशंस में उस पेशेंट को हेपेटाइटिस की तरफ, उसकी टेस्टिंग की तरफ मोड़ती हैं? व्हाट आर सम ऑफ द टॉप लेवल सिम्टम्स, कि एक हमारे व्यूअर्स को भी लगे कि भाई अगर ये सिम्टम्स हमें आ रहे हैं तो लेट्स गो टू अ डॉक्टर। और डॉक्टर कैसे जांचता है कि शायद ये रोग जो है, ये प्रॉब्लम शायद हेपेटाइटिस की तरफ से है? तो वो कुछ ज्ञान राज की बातें आप हमें बताएं।
So definitely, there is what we call as icterus. Icterus is yellowing discoloration of the sclera, of the eyeballs.
Okay.
The eyes become, जिसे कहते हैं पीलक आ गई. So that peeluk in the eyes, and there is a very dark yellowish colored urine. These two symptoms are, flag markers for jaundice. And of course, there's vomiting sensations, nausea, abdominal pain, weakness. Then when you eat a high fatty meal, then you'll feel very lot of discomfort.
Okay.
Usually these symptoms, the fatty meal symptoms comes at a later stage, but the icterus comes at a very initial stage.
तो ये डॉक्टर सुरभि ने डॉक्टरों के राज की बात एक बताई कि अगर आंख में पीलापन है और इफ यू आर हैविंग अ वेरी डार्क यूरिन समवेयर, तो इट्स हाई टाइम क्विकली कंसल्ट योर डॉक्टर, and the doctor would prescribe a pathological test. A range of tests are there perhaps, and that's a trade secret, we would say. That's the prerogative of the doctors. But generally, depending on the age, stage, and various other symptomatology which a trained doctor is empowered to prescribe, देन इट मूव्स ऑन एंड ऑन। 2025 का जो वर्ल्ड हेपेटाइटिस डे है, उसकी जो थीम विश्व स्वास्थ्य संगठन ने जो रखी है, लेट्स ब्रेक इट डाउन, इट कॉल्स फॉर अर्जेंट एक्शन टू डिसमेंटल द फाइनेंशियल, सोशल एंड सिस्टेमिक बैरियर्स इंक्लूडिंग स्टिग्मा that stand in the way of hepatitis elimination and liver cancer prevention। ये कहा जाता है कि हेपेटाइटिस का जो इन्फ्लेमेशन है वो लिवर को, गुर्दे का सीवियर डिजीजेस और लिवर कैंसर तक हो सकता है इफ इट गोज अनट्रीटेड। डॉक्टर सुरभि, व्हाट इज दिस स्टिग्मा ऑल अबाउट कंसर्न टू हेपेटाइटिस डोमेन?
So you see, what happens is that when hepatitis B or C, especially, and B and C, they lead to a kind of a. These are also transmitted through fluids, bodily fluids, B and C.
Okay.
Like needle reusage, needle transmission, or also through unprotected, sexual intercourse, and also through, it can go from mother to child also. BSD
Okay. So
especially.
is it somewhat related to the acquired immunodeficiency syndrome, the AIDS group
Well,
of diseases?
Transmission is similar.
Okay.
The mode of transmission is similar, but the etiopathogenesis is different.
Hmm.
This is due to the hepatitis B virus and the C virus, and the kind of symptoms it produces is hepatitis. But when it progresses, it can cause scarring of the liver, which is called cirrhosis, or it can lead to liver
स्कारिंग को
cancer.
थोड़ा आसान भाषा में समझाएंगे स्कारिंग का अर्थ?
You see, when the lesions in the liver are getting more intense, the scarring is being produced like scar, so it is cirrhosis, like corrugated, the liver surface gets, that way. So corrugated and scarred, so that is cirrhosis. Now, cirrhosis due to hepatitis B virus or C virus, this leads further to liver cancer.
Okay.
So now this is the flow this is the progression. That is why it is quite dangerous. Yes.
So since it's a virus, so it can attack, but you said its spread is closer to the transmission of bodily fluids for that matter.
Yes, yes. And similarly, hepatitis A and E are from they are from the infected feces, so water and food contamination.
अच्छा
Not
अच्छा
washing hands properly,
अच्छा अच्छा
improper sanitation, hygiene, not maintaining hygiene. So food and water contamination will cause A and E hepatitis.
Food and water contamination will cause A and E.
Yes. So when a patient comes to the OPD, usually with jaundice-like symptoms, usually in most of the cases, we suspect it is A. A. Viral hepatitis A is one of the most common forms of viral hepatitis, and we know that around 1.3 million people die each year from viral hepatitis globally, and out of which hepatitis A is um, um, quite common. I mean, I am not having the exact statistics for that, but then 2 million people die each year.
That's
from
perfect. That's
non-viral
perfect, Dr.
hepatitis.
Surbhi. That's a public health issue, but for the purpose of our layman people,
So,
so water and food purity is very, very important. Otherwise, it
Yes.
might cause that. तो
Yes.
क्या उबला हुआ पानी या filtered water, RO water, that is something which has to be traded, or a bottled water, that is something because because of the septic tanks or sewages and all, it has all seeped into the water cycle. So even in the hilly areas where you practice,
Yes.
people say हम धारी का पानी पीते हैं, but perhaps the seeping, the capillaries within the I
So
would say,
two things.
yeah.
One is, of course, that drinking water has to be pure. It can be from an RO, it can be boiled water, it can be, and the second is hygienic hand washing practices. This WHO stresses a lot on hand
जब ये
washing.
कोविड में कहा गया कि बार बार
Yes.
हाथ धोइए, इतने
Yes.
मिनट तक हाथ धोइए,
Yes.
तो यानी कि साबुन जो है वो है वायरस का दुश्मन, आप ये कह सकते हो कि एक साबुन से अगर अच्छे से आप सोपिफिकेशन
Yes.
से अगर हाथ
Needs
धोते
to
हैं,
have
और
thumbs and fingers and proper hand washing.
क्योंकि आलस लगता है, people are lazy at times, but then
No,
hand
washing is very critical.
and the surgeons what we see is that they scrub up to their ankle,
Yes.
hands. So I think जो भारतीय परंपरा में एक भाव है कि हाथ और पांव धोकर घर के अंदर जाते थे, कोई भी अगर आप शौच करने जा रहे हैं, तो I think that hand hygiene has to be very, 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 very proper.
Then the second point of prevention is that we also have vaccination.
Mm-hmm.
For hepatitis B, we have a entire trail of entire list of vaccinations for children, adults, health workers especially, and for all age groups. Children, adults.
For B and C, you are saying?
For hepatitis B.
Acha.
B, A also we have vaccinations.
Okay.
For A and B we have vaccinations.
Not C.
C, of course, the hepatitis C now is a entire monster in itself, because hepatitis C is similar to B in that in the intensity, gravity leads to cirrhosis, cancer. Hepatitis C recently we have got some drugs to for the remission. It will not cure completely the hepatitis C, but then it will lead to remission. What we say that management of the disease, and these drugs have come recently in 2015 or so before COVID, and now most countries are having these drugs.
So you said that one is obviously A and health hygiene, food hygiene, water hygiene is easy to do.
Correct.
You also said that B and C come from fluid transmissions.
Yes.
Now, if the mother has it, you cannot stop it going to the child, but then mother can prevent it. तो जो syringes का issue है वो पब्लिक हेल्थ में जो syringes की बात है कि syringes का incineration का एक पद्धति है, use syringes should not be used, disposable syringes have to be used. So people have to be very very wary कि आपके पास अगर sample लेने कोई आता है, they have the protocols, some of the finest labs, whatever they collect the samples, they use the disposable ones. तो थोड़ा syringes के बारे में बताइए, and uncareful sexual activity, what you said, which is also a golden protocol for preventing the AIDS. I think that protocol can be in the hepatitis C area. इन दोनों के बारे में थोड़ा बताइए.
So, before I go to this, both these aspects, I would also like to talk about hepatitis D. And hepatitis D is also called through the Delta virus, D for Delta virus, and this happens also with those patients who are, in risk zone of hepatitis B. So often B and D can occur even together, and they have the same zone of affliction. D also follows the similar pattern as hepatitis B, and the vaccine for hepatitis B will be partially protective for hepatitis D also. And D also has a similar course of action as hepatitis B.
Fair enough, fair enough. So
Yes.
let's come to the prevention part
Now,
of Surbhi. That's very important here.
Prevention. The syringes, the needles, when a sample is being taken or some injection is being administered, the needle is to be destroyed. The needle is to be destroyed for single usage. Now, what happens in many of the interior settings, the rural settings in our country, the reusage of needles is happening. What they do not incinerate or destroy the needle, what we call autoclaving or incinerate the needles. They do not destroy the needles, they reuse the needles, and in this process, the virus gets transmitted. So this is a very important way of awareness, knowing that reusage of needles. So of course, in like certified NABL certified labs and all, they're all following these precautions. But for the general public, it's important to know that be doubly sure, when you're.
तो गांव देहातों में जहां पर सुई लगाना एक बड़ा ही पैनेसिया माना जाता है, सुई लगाकर
जी
पेशेंट को ठीक कर देने की एक पद्धति है, बहुत सारे झोला छाप डॉक्टर जिनको हम कहते हैं,
जी
तो वहां पर भी इस वीडियो के माध्यम से, सीलिंग आर के माध्यम से हम लोग कहेंगे कि सुई जो है वो जब बंद आती है, जो डिस्पोजेबल सुई है उसी के माध्यम से सुई लगाई जाए, और वो सुइयां कैसे डिस्पोज हो रही हैं इन रिमोट एंड रूरल एरियाज. आई थिंक बायोमेडिकल वेस्ट का भी प्रसार प्रचार उतना भी नहीं है. इट गोज टू द कॉमन गार्बेज. दैट्स अनदर म्यूनिसिपल वेस्ट चैलेंज, बट दैट इज नॉट द फोकस आउट हेयर. बट इन्फेक्टेड syringes या reuse of syringes even in the family should be
Yes.
avoided perhaps.
Yes, definitely. Like when you're measuring sugar through the glucometer, those needles should not be shared. There should be either change the needle each time when you are measuring for a different family member, or use a different pen for each member. And even for a single member, after a certain like each needle has to be changed after certain number of measurements.
तो क्या ऐसा भी होता है कि वायरस जो है वो लेटेंट छुपा हुआ बैठा रहता है एक बॉडी में, और अगर दूसरी बॉडी में वो सिरिंज चली जाए तो वो दूसरी बॉडी में इन्फेक्ट कर देता है? ऐसा भी कुछ होता है
Yes,
डॉक्टर?
there are carrier states. Carrier states are there. And that's why we say fecal transmission. They are transmitted through the feces, they can be transmitted through bodily fluids, blood,
So, Dr. Surbhi, you talked a lot about the viral hepatitis. That is one part of it all. कोविड के वायरस का हम बहुत कुछ नहीं कर पाते थे. प्रिवेंशन ही है, और फिर वैक्सीनेशन केम इनटू बीइंग, अ लॉट ऑफ वैक्सीनेशन. यू टॉक्ड अबाउट इट. यू टॉक्ड ऑल्सो लॉट अबाउट द नॉन वायरल एस्पेक्ट्स ऑफ लिवर. लिवर को हम देखते हैं कि पीपल हु आर अल्कोहलिक, उनका भी लिवर खराब हो जाता है. तो इज इट ऑल्सो कॉल्ड हेपेटाइटिस,
Yes.
और इज इट अ डिफरेंट क्लास ऑफ डिजीजेस जो इंडल्जेंसेस बढ़ी हुई हैं सोसाइटी में? तो उसके बारे में भी थोड़ा बताइए.
So that, of course, we are having, as I said, there are non-viral types of hepatitis also. A very important, section of this is through alcohol.
Okay.
And alcoholic hepatitis is very very rampant. Leads to liver cirrhosis, leads to and the very discerning point, interesting point in this is alcohol-induced hepatitis can be reversed if you stop alcohol. before a certain stage, So if awareness is there that alcohol leads to hepatitis, and before the initial stages, if it's detected and you are made aware and conscious, if you stop using alcohol, so stop consuming alcohol, and
So has
with
it
a
been
healthy diet.
stopped, or is it there some permissible level, permissible medical level?
Medical sciences doesn't talk about permissible levels.
Okay.
What is toxic to the body is toxic to the body.
So it is entirely toxic.
It's entirely toxic. Alcohol, you see, alcohol was used by our rishis and our original healers in the form of asavs, arishtars. There the matra, the calibration of the alcohol, the amount of alcohol was very, very permissible. This is in the form of an asav, when it is giving in the form of medicine. But the moment you take it above that level, it becomes toxic to the body.
So ASAP concentration would be to what proportion for that matter?
It's just a medium, just a.
Acha.
And asap we don't drink.
It's like in the homeopathy pills, you have some alcohol. So it's more of a medicinal medium.
Medicinal medium.
It's not a drink in itself, you would say. So, what are some of the options you can really suggest to people? Because to get a high, from a medicinal, coming from a doctor, and understanding the stresses and challenges which the modern lifestyles pose, and also on the parallel side to keep the body warm. India is a warm country, by the way. We don't need that level of consumptions. But still, what kind of substitutes you can really suggest?
Very much. We have a lovely substitute called green tea.
Mm-hmm.
Green tea is very, very beneficial to the liver also.
Okay.
Though research trials are still being conducted and in process, but green tea is something which is, it protects the body from, oxidative stress, and enhances life expectancy, gives a very good warmth to the body. And green tea is something, there's so many flavors, we are having lemon tea, peach tea, and we can have so many other fruit flavors, and all kinds of concoctions are there for green tea. This is something, and this is developing really well. One is green tea. Of course, another is we have dalchini, what we call as cinnamon tea. Very, very, it's beneficial to the liver, to the pancreas. So these spices and condiments, you can mix. No, this is where
So you are proposing a different kind of a bar space going
Yes.
forward. If we have to prevent, because as Dr. Surbhi said unequivocally, without mincing any words, and sorry for the liquor lobby for that matter, but any amount of liquor is going to affect your liver at some stage of your life, come what may. That is what Dr. Surbhi's authoritative medical opinion is all about, without mincing any words, without defending any stuff.
Definitely.
For that matter. Okay. So, Dr. Surbhi, what are some of the other, I would say, other healthy liver, you would suggest to keep your healthy liver healthy? So what are some of the tips you would really like to give? Because doctors can only do once things are done, the surgical procedures, tipping, and a lot of surgical aspects. So just tell us more about the surgical pathways also when the livers are, you talked about cirrhosis and the extreme stages of liver treatment. That is one pathway. Obviously, when someone has really destroyed his or her own liver, and liver transplant has become a kind of a feature, but that is not the healthy way for that matter. So just tell about that pathway and the other pathway to keep a healthy liver healthy. Jivem Sharda Shatam, as it remains the founding philosophy at the Healing Art, how we can keep our organs healthy. One is by preventing alcohol in any proportion. That is a done thing. Dr. Surbhi talked about healthy hand cleaning so that the hepatitis A and E viruses don't touch upon. B, C, and D are of the same era. So syringes can be avoided, and also the unprotected sexual activity. I think that's a stigma and taboo. But since in today's times, 23 OTT apps which were doing a lot of vulgarity and tantalizing the populace, thanks to the Ministry of Information and Broadcasting, and thanks to Uday Mahurkar sir and his forwarded campaign. So a lot of this kind of a content, it is trying to create a kind of a promiscuous environment in the society at large. That will also have an impact on the B, C, and D proliferation and transmission. We can curb it as much as possible. And the other side, I would say, doctors will be on the treatment sides and also on the healthy liver side. Yeah.
So when we talk of healthy liver, one very important aspect is also obesity. We need to cut weight.
Okay.
We need to cut weight because fatty liver and all these liver is an organ which is affected by weight, obesity, and obesity is of course causing it's another monster all across. So this is one thing. We have to exercise regularly, to keep your liver fit so that oxygenation to the liver is adequate. So there's no ischemic element. This is another organ affected by ischemic hepatitis. Then we have enough water intake. Like hydration should be adequate. And then a lot of green leafy vegetables. So a diet, a healthy, balanced diet. And when we say a lot of non-vegetarian is going on in the population today. So, in fact, we have research has proven that a certain kind of an TMA kind of a element is present in non-vegetarian food, which is highly damaging the gut. The latest research which has come, and the TMA toxin is present in the non-vegetarian.
So somewhere you are saying that since liver is an integral part of the digestive system, so what is good for the tummy, what is good for the stomach is also good for the liver.
Yes.
Largely.
Yes. And a lot of red meat which is being consumed, animal meat is being consumed. Somewhere, these are all causing, damaging the liver also. Because you see, they have a different kind of a fat constitution, So, well, it's difficult to tell a non-vegetarian person to say that not to consume non-veg, but at least, you can move towards.
It can be optimized, it can be minimized.
It can be optimized.
Because if the goal is to have a healthy life,
Yes.
so just tell us more about what are the advanced procedures in liver when people have destroyed their livers by liquor, by red meat. Viral transmission is one part. Nothing can be done beyond that because that's a different dynamics. So what are some of those procedures which are there leading up to even liver transplants?
We have surgery, which is of course a portosystemic shunt, the intravenous, through the tip surgeries there. The liver shunting procedures are there. We have portal hepatitis, there is a circulation, the liver circulation gets affected when it gets blocked. So then there are, alternative passages which are created to produce the circulation for the bile flow, for the pigment flow, for the metabolism process to go on. And of course, we have certain, liver, once it reaches the stage of cirrhosis, then it is quite irreversible.
Okay.
So but hepatitis A, E are self-limiting. They are self-convalescing. The patient will recover on his own. He has to just avoid a high fatty diet.
Okay.
Be on rest slightly, take lots of fluids, water, pure drinking water, which is not contaminated.
So not much of medicine is required in any.
Just hepatitis A, which is jaundice, there are a lot of quack practices which say, okay, you take this some steroids or some kind of Ayurvedic formulations which are not pure Ayurveda, but they are actually steroid pills. So these are harmful rather. So what you need to understand, the authentic healthcare practices.
So self-limiting, what Dr. Surbhi ने कहा कि अपने आप. And what is the time frame, Dr. Saab, of this?
So it usually takes 3 weeks for the bilirubin levels to come down.
Okay.
There are certain fruits which also help. Say for example, we have kiwis and kamrak, which is said, and a lot of normal healing. We say muli ki roti, aloo ki roti khana chahiye to help digestion and not take a lot of butter, ghee, and all. We avoid these practices. So and rest. So no, this is very, very good health to heal jaundice, and of course, Live 52 and these formulations are largely placebos. And because, if you have to understand that the A and E hepatitis viruses this illness is self limiting. Within 3 weeks to 4 weeks, the patient will come back to normal health. You just need
So,
to
but not
avoid.
much of physical activity.
Yes,
बहुत ज़्यादा.
avoid lifting weights, heavy weights.
Hmm.
Don't put stress on the liver. Give a little bit of rest.
And what about B, C, and D?
And B, C, for B and C, we have drugs. For B and C, for D also, we have drugs.
For relief.
For relief, that they can cause a remission, B is very serious. I mean, it's quite a, intense affliction of the liver. C again is an intense affliction of the liver. For A and B, we have vaccines also. And largely for hepatitis, it's, prevention is the best way. Prevention is the best strategy.
See, that remains key. Keeping healthy people healthy remains the core focus of it all. And these kind of advices coming from the authoritative seat of All India Institute of Medical Sciences, alumna. So I think that remains the hallmark of AIMS, where they say that accurate diagnosis and optimal investigation and judicious medication. And when medication comes in the AIMS parlance, that is what they say, that ahar, vihar, vichar, that is the first 50% of it all, and then aushadhi. So they go as parallel tracks. So as Dr. Surbhi has given कि भाई दवाई की जरूरत ही नहीं है, अगर ए और ई diagnose हो गया, it is self limiting. You have to avoid a lot of foods which are not there. She talked about very much fatty foods, and then some of the meats, the red meats and others which can be avoided. Liquor is a big red.
A glass of tart or buttermilk in the morning just is so healthy for the liver. Curd, yogurt, so good for the liver. And a lot of these green tea, as I said. Why not?
So they cleanse the liver systems automatically.
Yes, and then haldi, turmeric has also been proven to have.
So some of the teas are turmeric teas are very much out there.
Turmeric tea, turmeric milk, for that matter, toned milk, turmeric milk in the night, what we say, in COVID times also a lot of it was suggested and recommended. It's very good.
So, but as WHO says that testing, because as Dr. Surbhi from the very start says कि hepatitis needs a pathological testing. Yes. For a deterministic treatment to fall through.
Even imaging,
yeah,
ultrasound and all that.
That's a next level, and that can only be done when you approach your GP or family doctor. Yes. Who has a hang of your health conditions, the whole family. Because, and hepatitis, does it spread between the family members if one person gets it? So what kind of probability is there it will affect the other family members as well?
Well, you see, since it's a viral disease, definitely it can spread, But usually cases of transmission are through, as I said, fluid, like blood transmission, sharing needles that way. Or it can be through, the fecal transmission, like viral hepatitis A and E especially, So if hand washing is not there and, so, sanitation generally is encouraged that way. But then usually it's not that communicable. I mean, if a person has jaundice, so it's not that frequent that immediately your family members would get.
But still, the hygiene standards have to be improved upon.
Yes.
See, obviously, when जब भी रोग कहीं परिवार में आता है, everyone gets affected because the financial aspects of it. Because जैसा कि WHO ने कहा इस बार की थीम में कि financial, social and systemic barriers. Because अगर आप 3 हफ्ते के लिए, if you are the lone earning member in the family, nowadays when the gig economy has taken over, and even in the most corporate of the scenario, getting a leave for such a long duration, it's a tougher thing. It's not a 1 week or 3-4 days kind of a thing. So chronic hepatitis B and C silently cause liver damage and cancer. It's a WHO release. We wish to just put it across. And despite them being preventable, treatable, and in the case of hepatitis C, it's a curable also. There was a Nobel Prize for hepatitis C also. It came recently. So the theme emphasizes the need to simplify, scale up, and integrate hepatitis services. Vaccination, self-injection practices, they should be avoided. One of the areas which is culturally not so very dominant in India, but it is coming up, the drug intake. ड्रग्स लोग जो नीडल से लेते हैं, भारत में तो कम है, बट और देशों में उसका प्रोक्लेविटी इज हाई. Harm reduction and especially testing and treatment, because if it can be detected early, as Dr. Surbi said, key pathology through your blood samples and then through imaging, a lot can be done. The liver health, so liver is a very integral component of your vitality, your digestion for that matter, and fat after all is core. Fat digestion is very important. So integrated care, as Dr. Surbhi said, ki ahar, vihar, and vichar. These are some of the core aspects. Ki aap, how are your food? It can be there. Your vihar, safe practices. Obviously, some of them are cultural traditions, are cultural taboos. We would say they are the biggest protectors against these kind of infections, these kind of viruses. Progress is good, but progress under the envelopes of the cultural protection we have talked about.
And then medication also, another last but not the least, is popping pills like paracetamol, NSAIDs, painkillers,
Oh, that
antibiotics.
also causes
Yes,
matlab, the
over
excessive
medication.
over medication.
Yes, over medication and this medicine toxicity is also known to cause hepatitis.
Mhm.
This is
So I think I
drug-induced
think
hepatitis.
one take home message on this World Hepatitis Day. I think Dr. Surbi is saying that get your medicines audited. आजकल होता
Please
क्या है
don't
कि
self-medicate.
we
Yes.
one is self medication, the other is for various at a certain age we go to a multiple set of doctors for cardiac, for gastro, for multiple super specialists are treating us. Somewhere or the other, due to the paucity of time with them, they are not able to integrate or converge the entire treatment protocols. So it is always handy that you reach out to your family doctor, your GP, and give them the entire treatment protocol so that he or she can look through as a bird's eye system that whatever medicines you are taking for various ailments, because over a period of time it all stacks up, it all becomes a big bundle of medicines, and somewhere is it hurting or is it not hurting. It is always good to have a medication audit by your GP. So he or she might help you. Okay, Doc Saab, this medicine is not in tandem with that. So maybe a kind of an
Yes.
integrated care. That is also one of the themes of so over medication which is happening today. We are taking so much of pills. पेन को सहन करने की छोटी सी भी क्षमता हम लोग नहीं रख पा रहे हैं. So I think one of the core messages is going back to our cultural taboos, our traditions of not popping pills for every small thing, and obviously adopting a kind of a prohibition restraint. ये नहीं खाना है जिसको पहले परहेज की बात करते थे कि नॉट
Absolutely.
डूइंग समथिंग इज इक्वली इंपॉर्टेंट बिकॉज आवर बॉडी इज डिजाइंड for 100 years. That is what the human body is all about. So indulgence, if it can be moderated, yes, the most modern treatments are there, there is no doubt about it. As Dr. Surbhi said, all surgical aspects, all kind of vaccinations, all kind of things are there, but somewhere or the other, prevention is better than cure, and keeping healthy body healthy, I think that is what we should aspire for, and that is the core objective at Arogyam Institute of Integrated Medical Sciences. That okay, if something happens, we have the medical ecosystem to help you. But why, like post accident? Why to do an accident of your automobile? I think that's a philosophical dimension. Thank you, Dr. Surbi, for such an enlightening, healing hour. आई थिंक वी गॉट टू नो अ लॉट अबाउट अ वेरी क्रिटिकल ऑर्गन ऑफ आर लिवर, क्योंकि पेट की बातें तो हम करते हैं बट डाइजेशन का वो जो कोर कंपोनेंट है, इट्स अ काइंड ऑफ अ बूस्टर, इट डाइजेस्ट फैट इन पर्टिकुलर, उसके बारे में ज़्यादातर हमको नहीं पता होता. एंड यू हैव सेड अ नेट ज़ीरो ज़ीरो टॉलरेंस फॉर लिकर. I think that is a message. A big statutory warning has to be out there, and your suggestions to really embark upon a lot of these coming up green teas, lot of these beverages which are healthy. I think in our offices, in our parties, we can really offer them. The Japanese culture, for that matter, they offer so much of tea. Would you have tea? Their per capita consumption of tea is very high for that matter. So living a healthy and life is so very vital. कि जीवेम शरदः शतम, पश्येम शरदः शतम, बुद्धेम शरदः शतम, रोहेम शरदः शतम, पूषेम शरदः शतम, भवेम शरदः शतम, भूयेम शरदः शतम, Bhuyasi Shraddha Shatam. With this prayer, we take your leave, and we would be back with yet another healing hour on yet another health condition, or yet another issue pertaining to the entire healthcare ecosystem from the authoritative seat of Dr. Surbhi. Thank you